Hello, friends. Good morning, good afternoon, good evening, from wherever or from whatever part of the world you're listening from. Today is a word of introduction. I still remain Belinda by name. Today is World No Tobacco Day. We know the implications of tobacco smoking. Tobacco smoking has its physical consequences and its mental health risk also. When I think about the physical consequences, tobacco smoking, especially when you have a chronic history of tobacco smoking, it can lead to cancer, lung cancer. Data has it that about 80 to 90% of people with lung cancer are due to having a history of tobacco smoking. It can cause cardiovascular diseases, heart conditions. It can cause you to have tooth discoloration when you smoke a lot. Also, these are some of them. It can cause you to have chronic coughing, any respiratory problem, the wheezing and stuff like that. That's what chronic tobacco smoking can cause. It also has this mental condition, which we don't know about. It can cause you to become more depressed. But the irony of it is that people who experience low self-esteem, depression, they tend to smoke because there is this temporary relief from depression. Because when they smoke, the main substance in smoke in tobacco, which is nicotine or nicotine, is being released in the brain just within 10 seconds. It's released in the brain. And then with that, you have this happy feeling, positive self-image, a happy feeling. But it only lasts temporarily. It's just for a brief. It's just briefly. And then when it starts wearing off, you see that person becoming more low in mood, tense, anxious. So that's the side effect of it. And then because that person is becoming low in mood, you'll be like, oh, when I just smoke, I have this positive feeling, the sense of pleasure. Probably I'll need to go back and smoke again. And the person go back and take another cigarette. So by that time, it starts becoming a habit. It starts becoming a habit. And then to that extent, as it continues becoming a habit, it becomes an addiction, which is difficult to stop. It's difficult for smokers to quit smoking. So what's the solution for you to quit smoking? There are practical steps you can take to quit smoking. You can just tell yourself that fact, I want to quit smoking. You can also involve your friends, your families, members that know that you're smoking also, for them to help you to stop smoking. And limit being among your friends who smoke. Mind those environments where your friends, limit association with them that smoke. There are also many programs, especially if you're in the UK. The NHS has a program for stop smoking. Even the government also has policies to guide youth to quit smoking. They have policies to enable youth to quit or reduce the amount of tobacco smoking. Even the government has bring about some other policies or some other methods that you can reduce to minimize smoking. Because with tobacco smoking, you're killing or you're harming your lungs, because with the tobacco smoking, it comes with the tar, the carbon monoxide poisoning. So that when you see a chronic smoker, when you check his observations, the vital signs, you check his pulse rates, they are abnormal. You check his oxygen saturation, they are low. So, but when they stop smoking, you find out that their pulse rates start becoming normal, their oxygen saturation starts improving. When they do their blood readings, the carbon monoxide poisonings it start dropping. All their body systems, the lungs start repairing itself. Like in a year, about or a few months after smoking, the lungs start repairing itself. The person will be able to breathe normally. The risk of cardiovascular diseases will start reducing. That's the advantages of. But there are other methods that the government, I don't know, for the UK, Other methods that the government has initiated to reduce tobacco smoking, because in those methods, it's called nicotine replacement therapy. Nicotine replacement therapy comes in different forms. There are the skin patches where they apply it on your skin. There are one of the tablets. There are those in the nasal sprays where you spray. There's one of the chewing gum. There's one of the pouch that they use also. So with that one, you still have that nicotine, the substance, the main substance in tobacco, nicotine in there, but it's in a reduced quantity, it's a reduced amount. And the advantage is it's being released, like the skin patch is released. That nicotine is released slowly in the body. You still feel that, get that feeling that tobacco gives you, but not with the side effects of the smoke, the carbon monoxide poisoning. They have the poisonous substance, so it has its own advantage actually. And here in the UK, the government are advocating for e-cigarettes, because the e-cigarette is like an electronic device, but without the side effect of it comes in a vapor, but it doesn't have the side effect of that tobacco smoking, like it doesn't have that tar or the carbon monoxide poisoning with it. So it's a bit safer, and that's one of the methods they are initiating for people who are planning or on their way to quitting smoking. So today is the World No Tobacco Day. And WHO, they put in this program to enable people to be able to stop smoking. That's what they put this program for all about. And it's being celebrated on the 31st of May every year. It's celebrated. Or that youths, especially young ones, should be able to reduce smoking, tobacco smoking. But the theme this year is protect the environment. Do you know that when you smoke, the smoke that is being released to the air affects our environment? It destroys the ozone layer and thereby bringing about global warming. Also, the tobacco cultivation leads to deforestation. And you know the implication with the deforestation. It also brings about global warming. Global warming. I'm not advising you, I'm not forcing you to stop smoking if you are a smoker. But just that's my own piece of advice. If you can, it's better you stop smoking. It's better you quit smoking. Because you will do your health good if you stop smoking. Thank you. That's my small piece of advice. Bye.